It says we're live.
We are.
I think we are.
All right.
Hi, Rivertown Family Chiropractic. We are pumped to be here with you today and talk through chiropractic care and pregnancy. I have Dr. Rachel with me today.
We really are excited to be here. I care a lot about taking care of pregnant women. And actually, when I was a chiropractic student, I didn't know that this was going to become one of my biggest passions. But as an intern, I was in a really niche little prenatal and pediatric office. And it's amazing the effect that taking care of pregnant women and moms has on the entire family and future generations as well. And supporting women through pregnancy so that they don't end up in the cascade or the domino effect of medical interventions that can happen if you go the other way is also really important to me. So we're going to be giving a lot of information, and none of this is to judge moms for their version of their ideal birth, but just to provide as much information for your body to be as healthy as possible going into something so physiologically intense.
Yeah, that's awesome. That's awesome. And my experience has nothing to do with chiropractic school. I'm not a chiropractor. It just has to be with, I'm blessed to be a mom of 4 kids and have had chiropractic through all of my pregnancies and labors. And I really believe that I wouldn't have 4 kids had it not been for chiropractic. I would have said, this is too hard. You know, you hear people that don't have chiropractic as part of their pregnancies, and you hear what their challenges are, what birth looks like. And you're like, I don't know if I would have done this 4 times. And so I'm so thankful that Mark and I found chiropractic before we had babies, because it gave us the ability to learn how this is what pregnancy should look like. This is the freedom you should have during birth. And these are the tools that we have to really have the most successful experience bringing our babies into the world. So,
and I think that's true for all of life, right? Too, not just pregnancy. We talk about chiropractic as optimizing your life and your health, and that normal physiology is important, not just in pregnancy. We want our bodies to be working as well as possible, to be as healthy as possible. If you patients need a refresher on subluxation and what that optimal function looks like, I would go back and listen to the Chiro Live that I did with Dr. Eric earlier this year on just what is subluxation and how does the nervous system heal is a good place to start.
And I'm not a chiropractor, but subluxation, less light, right? Like optimal function, optimal light. And when there is subluxation, there's less light, less function, less healing.
Interference to healing, So Dee Palmer, the founder of chiropractic, knew this all the way back in 1910 when he wrote The Chiropractor's Adjuster. He said that the principles of chiropractic should be known and utilized in the growth of the infant and continue as a safeguard throughout life. He went on to say mothers and their babies are liable to be injured at childbirth. Many have their vertebra displaced at this critical period, causing acute and chronic diseases. If the adjuster is a chiropractor, he can adjust such and prevent disease. So people are often surprised that pregnant women and infants get adjusted, or by how well they really respond to chiropractic care. But it's been known and documented for over 100 years.
And your body during pregnancy has more relaxin because you're preparing to birth out a baby. And so that means your muscles and your bones are just moving at a different speed and pace and flexibility than normal. And so it's the best time to get adjusted because your body is shifting more frequently than it usually is.
Exactly. Yep. And all doctors at RFC are Webster certified, which is the gold standard for chiropractic care. And what we're focusing on primarily is neurobiomechanical power. So every time we say the power's on, we are focused on the nerve telling the muscle to contract, in this case, smooth muscle or uterine muscle. And actually power, passage, and passenger.
Wait, say those again.
Power, passage, and passenger.
The baby, passenger.
Passenger, baby.
Baby, got it.
Power, nerve power from your nervous system. Passage is your actual pelvis, the space that passenger baby is going to go through. Those are obstetrical terms. They teach them to OB-GYNs, and they call it power too. It's a medical term. It's not just what we say in the office. It's actually power from the nerve to the muscle to do work. If you make a fist with your hand, and you squeeze really hard, the muscle power is the nerve telling the muscle to contract. And it's the same in your uterus, which is a hollow muscular organ. When we're talking about uterine dysfunction, it relates to expulsive forces, pushing out, expelling. So the ability to expel and push and create a strong, synchronized contractile wave that initiates labor and ultimately accomplishes birth. That is 100% dependent on the nervous system. If the nerve is offline, so is the uterus. And uterine contractions are either weak, like they're not strong enough, or they're out of sync. They're not coordinated with each other.
Yes. And every time you have a contraction, the goal is that that contraction does exactly what it's supposed to do. We want purposeful contractions that do work, that open you up to meet your baby. And if your brain is not communicating with those muscles to make that happen properly, then you're going to have purposeless, useless contractions. And that's no fun.
Your brain does that through your sacrum too. The nerves that go to your uterus come from a certain segment of your sacrum that we're adjusting every single time with Webster's technique. There are also some ligaments that are unique to pregnancy.
I did not know that we had bonus ligaments.
You do? Yeah.
Yep. I knew there was a bonus organ, like placenta, extra organ. Did not know there were bonus ligaments.
There's maybe a remnant of it in everybody, but actually they have muscle fibers. So they develop and grow during pregnancy to support the uterus and the way that the uterus is held inside your hollow body. So on the farthest left over here, we've got the broad ligament. It's like a wing structure, and it goes from the sides of your uterus out to the sides of your pelvis. So it goes kind of like this across the belly. And it is more like a muscle. So it contracts and it gets tight and it can create tension. I like to think of it like a bed sheet. If you are all wrapped up in the bed and you're really cozy and then you need some space and you're like kicking to get out of the sheets, that's what tension around the broad ligament can cause, is that constricted bed sheet tightness.
And so Webster's technique addresses that?
So Webster's technique addresses pelvic alignment, which is where this broad ligament attaches on the side.
Got it.
But the technique does directly affect the uterosacral ligament, which is the one in the middle there. That one goes straight from your uterus to your sacrum. We're adjusting your sacrum with Webster's technique, which is taking pressure off of that. And then also the round ligaments hold the uterus toward the front so that it doesn't slouch back toward your spine, which we'll talk about again later when we're talking about couch slouch and baby positioning. But the round ligament is what can cause downward pressure or lightning crotch, if you've ever heard a pregnant woman say she has that. It has the ability to contract because it's a muscle. So in non-pregnant women, it's a few millimeters, and then it grows and it goes all the way down to your mons pubis, or the top of your pubic bone, when you are pregnant.
And helps hold baby, ultimately.
Yep. It prevents the uterus from falling back onto your organs. It keeps it pulled forward and keeps baby's head off of your cervix until you're ready to give birth. It keeps it suspended in your belly.
So when I am super pregnant, as I'm getting more and more pregnant, I'm not able to lie on my stomach. I'm like, Mark, you're not going to be able to adjust me anymore. Like, this adjusting thing will not work. And then he's like, no, there are these things, these pillows. And so you'll see them in our office. They're pillows with holes in them. And they're actually incredibly comfortable as a pregnant woman to actually be able to lay on your stomach and kind of just relieve some of that pressure. And that is how we're able to safely adjust all of this during pregnancy, during all phases of pregnancy. There's a first trimester pillow, a second trimester pillow, and then they can stack for a third trimester as well.
Yep. Thanks for mentioning that. So I, as a chiropractor, don't do anything with baby. Baby positioning is outside of my scope. The passenger is who we're talking about. However, the passenger can have more room for a healthy positioning when mother's passage or pelvis is well aligned and those ligaments are well cared for. So indirectly, we're supporting maternal physiology to support baby positioning.
One of the things people ask, let me get your beautiful face. You're crowded. There we go. One of the things that people sometimes know chiropractors can help with is when babies are breech, right? And so someone will say, hey, does your doctor team, do they flip babies? Like, my baby's breech. And it's like, no, they don't flip the baby. Like, your body will help the baby be in the optimal position when your hips are in proper alignment, when your ligaments and muscles are functioning the way that God created them to be functioning, when subluxation is removed. And so it's one of the biggest kind of misconceptions in the pregnant world is that there's a chiropractic technique that can flip babies. No, there's a chiropractic technique that can put your body in optimal function so that your baby's position is in the optimal function for it to be born, or optimal position for it to be born.
And that optimal position is up here on the top left, the OAP, or occiput anterior position. You can see when baby's about to come down from that position, the back of its head is right on the cervix in the front of that picture. That's going to efface and dilate the cervix and cause that nice, well-synchronized uterine contraction. Right next to it, occiput posterior position. That one is the mom that has low back pain or tailbone pain because the bony back part of baby's head is pushing right on her sacrum.
Especially during birth. They're having a lot of back labor. They're really feeling that in that birth experience.
Exactly.
So getting baby in optimal position not only helps with the catching of the baby, but also what does birth look like? What do those contractions feel like?
Yep. Experience overall. One way to keep baby out of that occiput posterior position that's going to be more painful for mom is to avoid reclining. And Janelle knows how important this is.
I think we have a slide, right? Yes. And so this is preventing this couch slouch position. It's so, you just want to, like, everything in you is like, it's third trimester, you've been carrying on a really like 40-pound basketball and you just want to lean back in your chair. And it's just, that's what you want to do cognitively, but we need to tell ourselves, no, that's not the right position for baby to be in, because baby then is going to consider flipping potentially, consider kind of moving in an inaccurate position. And so what we want to do is make sure that we are sitting properly forward more consistently, especially in third trimester. We just literally moved a yoga ball into our living room. And so it was just an option for me. It was like, okay, I'm just going to wobble on this yoga ball. I'm going to keep my hips open. I'm going to make sure that baby's kind of sitting more upright with me. If you do want to lay on your couch, laying on your side with some pillows to help support baby, highly recommend getting a really good pregnancy pillow for sleeping. These are some good photos too, to kind of see, okay, what is the position need to look like so that baby is consistently in that right space, especially in that third trimester.
A visualization that might help with that is if you were to put a flashlight on your belly button, and if you're reclined and you're leaning back and you're chilling, the flashlight is going up toward the ceiling. You want your flashlight on the ground. So if you're sitting and your lumbar support is good, then your pregnant belly button flashlight is going to be going down toward the ground.
Yes, so good, so good. And it's really just this conscious decision every day for me leading up to having my babies is, what am I doing today to promote the best experience for my birth and my baby being delivered, my baby being caught. And so whether that's couch latch, whether that's being diligent with adjustments, whether that's being diligent with home care, so that birth is as efficient as possible, my contractions are as efficient as possible, and baby comes out as quickly as possible.
Okay, I want to touch on lightning crotch. I know we have a few patients who are experiencing it right now, and it's no fun. So,
and I've never heard this term before, so I'm excited to learn.
So a medical doctor will tell you that you have symphysis pubis dysfunction, but really what you have is pelvic rotation. So your passage is rotated and unaligned. And then the inner thigh muscles, your adductors and your glutes, specifically your glute medians right out on the side, are probably weak. So it's way more comfortable to spread your legs or to waddle, right? To like straddle the table or lean back with your knees open. But you need strong inner thighs and strong glutes for birth. And it's going to take pressure off of your pubic bone in the middle. So this image shows you how to just practice squeezing your knees together, firing up the inner thighs. What's that old tool, the Jane Fonda tool, where you squeeze it between your legs?
Thigh master.
A thigh master. Yeah.
Yep. For me too, any sort of pelvic work that I was doing during labor or during pregnancy, I did it every time I was at a red light. So if I saw a red light or a stop sign, it was a reminder for me, I'm sitting at a red light. I'm going to do some pelvic work right here in this moment to really just get those muscles activated and get me ready mentally for what the work I'm about to do to bring a baby into the world.
That's good. Yeah. So because I don't move baby for you at all, there are some services or some functional movement that can help encourage baby into the optimal position in addition to adjustments. Mile circuit takes about 90 minutes. It is very thorough. You could do it once or twice a day. Spinning babies is a little quicker. They have a free version or they have a paid version. If you hear from your midwife that baby is breech or something, I wouldn't be surprised if they told you to do spinning babies 7 to 10 times a day. Inversions, really encouraging movement. And then birth fit, I also really encourage for before, during, and after pregnancy. Check them out.
That's awesome. I've had the pleasure of having 3 different midwives over my 4 different babies because I've moved around and had babies in different states. And so I have a plethora of midwife advice. And one of them was really committed to 100 squats a day. And you do 100 squats a day from the day you are pregnant up until the day you push out a baby. And the reason is that those muscles to squat are muscles that you need to strengthen and use and keep strong all throughout 3rd trimester so that you're ready to birth a baby. Squatting is one of the optimal birth positions to kind of help baby come down. I just walked a birth alongside a birth, and we needed to use that squatting position to help flip the placenta come out. And so if you aren't strong enough to do that because you haven't been doing squats consistently, that's a tool that you can't utilize. And so we want you to have all the tools in your tool belt. So be diligent in squatting so that you can meet your baby. I also really love prenatal yoga. The benefit now with YouTube and DirecTV and YouTube TV is that you can literally click a button and someone can do prenatal yoga with you. But it's cool because we will be in positions for 1 minute. And you're working on a position for 1 minute, which is usually how long contractions are. And so it's like, I can do anything for 1 minute because over my pregnancy, I've done 100 wall sits for a minute. And so I can totally do a contraction for a minute because I have that. I know what a minute is in my spirit, my soul, my neurology. And so that's another really powerful tool for you to utilize during your pregnancy to prepare for birth.
Awesome. Do we have a minute to talk about mindset, you think?
Yeah, let's go
All
there.
right.
For the record, Dr. Rachel and I thought we should talk about this for 3.5 hours today, but we said we're going to do it in 20 minutes and power pack you with some just really good content as it relates to chiropractic and birth. Yeah.
And this slide in particular probably could be its own workshop in and of itself. Mindset is huge for overall neurology, but fear and the hormone cascade that comes with fear can literally stop or stall labor, which then sends you into the domino effect of interventions of trying to speed up that labor, depending on who you're working with.
Someone told me once that every person in your birth space can add up to 2 hours to your labor time, just by the people that you pick. And so it's like, do you want them in your birth space? Do you want this person in your birth space? Do you want to knock, knock, knock? We have a group of medical students that really are interested in birth. Would you mind all 6 of them coming into your room? It's like, I would, because that's 12 hours. And so be really diligent and protective over what that space looks like for you. And that's not just, that's not just who enters that day. That's the provider that's walking this with you, what their perception and belief is about birth as well. I think one of the things I wanted to jump back to had to do, we've been talking optimal position. We've been saying optimal position, optimal position. And depending on who your provider is, their perception of optimal position is different. So you've got providers that say, if you don't fall within these 2 lines, then you're not optimal. You no longer can push out your baby, or you no longer can do it your way, or you now have to have these interventions. And depending on the person you pick, they then say, oh, no, actually normal is this, or normal even is this, or, oh, we had a baby that cord was wrapped around, so Luke didn't tuck his head properly, so he came out more here than here, right? And so this midwife had the skill set to say, this is still within normal. You're going to do a little bit more work. You're going to walk some stairs during transition, and you're going to do some different positioning. And he was able to be born naturally at our house as well, even though he's still kind of out of the variation of quote normal. And so that's important too in picking a provider. It's important with picking a provider that you're deciding how much normal do they allow. Someone just posted that, it's your husband's job to protect your birth space. I completely agree with that. And that lends itself to those conversations happening prior to birth so that they know what protection looks like. And you guys have defined together, what does it look like for it to be protected? And how do we do that? I would maybe even go as far as to argue, if you choose to have a baby in a hospital setting, we're kind of talking a little bit more into birth, but just to respond to this question, if you do have a baby in a hospital setting, it might be wise at that point to hire a doula to help with that too. So it's not all on your husband. Your husband can be with you, and doula can help protecting your space.
Mm-hmm.
So,
and I think that's important too, just in that we're giving a lot of recommendations. We will in the office. I want to provide all of the resources for movement and mindset and pregnancy and whatever you need. However, you could do everything perfectly and still not have an ideal birth, or vice versa. And whatever you and your partner or your family choose for your birth, my greatest hope for you is that it's intentional and it's chosen, and that it's your version of your ideal birth. So we'll provide all of the information and support you in whatever you decide.
Yeah, that's great. And really, the journey of pregnancy is the journey of beginning to figure out, what does it look like to care for my baby and care for myself at the same time? And how do I do that? And so during pregnancy, it's a little simpler, because a lot of caring for you is also caring for your baby at the same time. You getting adjusted is caring for your baby at the same time. You know, you doing home care and you wobbling and you not couch slouching, like that is you also taking care of your baby. Once baby comes into the world, it looks a little bit different. And so we have to exercise that muscle as moms in pregnancy, so that when baby comes into the world, we know what it looks like to on our own bodies, take care of ourselves, take time for ourselves, so that we are ready to really be healthy moms that are caring for our babies.
That's awesome. Yeah. If you have questions, type them in. Even if you're watching this on replay, I'll go back and check the comments. And hopefully there will be a full-length pregnancy workshop coming into the office here soon.
Have a great day.